So I'm here with a very smart young lady, and she has very important questions to ask. And I think those questions should be asked by all of you. She's done the research very carefully about exosomes, and she was wondering for her hair. So right now she's using a low-level light energy for her scalp. She's using it 3 times a day, and she thinks that there is some improvement. And this study was proven in 1956 in Hungary by a professor who was checking it on mice, and it is actually FDA approved. I recommend doing it 5 or even 7 days a week for 30 minutes, depending on the distribution and the machine that you're using for the right energy. And it is actually something that was FDA approved. As I said, the machine that was tested was called iGrow, but there are other companies now available that provide the same thing at different costs. So you can shop around, just make sure it's good.
I was asking the risk of scarring.
The risk of scarring. So this is actually used exosomes to repair scarring and to reduce it. So we do it a lot after facials, microneedling. I even use it sometimes with the injectable to help build collagen. So if anything, this is remodeling scarring, softening it, allowing collagen elastic tissue to make it more aesthetic and less hard. So everything is balanced.
And then I was going to ask, could the exosome therapy cause systemic immune reaction after getting it?
Yes, so that question you haven't asked. Yes, correct. So the immune reaction, because there are no cells over there, it cannot cause immune reaction unless you have antibodies to the cell membrane. So if you have antibodies to the cell membrane, for example, you have bullous pemphigoid, which is an autoimmune where you're attacking your own cells, or maybe pemphigus vulgaris. The exosome is a vesicle, and it is a lipid bilayer, like all vesicles, because it's supposed to be part of the cell. It's all the necessary ingredients are actually put into a vesicle that is invaginating, right? So it's forming. It's kind of like a budding from the cell. Then it collects all the stuff inside, and then it sends it like a submarine around to hone in specifically with the right message to the right organ, based on SOS signals that it sends that it needs help, or based on its special target cells. And that's why it's also important where you get the exosomes from. As long as you get those exosomes from mesenchymal stem cells from umbilical cord, knowing that those exosomes are programmed to attach and to specifically send the signal to the growing healthy cells of the embryo, they will not attach to cancer cells, and they will not release their ingredient to cancer cells, because those are unhealthy cells. It will specifically hone in, tag like a landing strip, magnet to the areas where the cells are. Now, you were asking me something, and it was really key, and that was, what's the name of the company? Now, the one that I went to the lab, research and checked, is called Regenerative. And I looked at the lab. Unbelievable how much money, effort, equipment, attention they spend in order to make sure that everything is at the highest rate. I don't get paid by them. I don't work for them. I work with them. And I've done it for myself IV and for my family members, besides obviously patients too. So it's important also to make sure that there are no live particles in it. So when you're doing exosomes, there are no stem cells there. Some companies, they don't filter it as well, and they add some stem cells, which may make you feel better, but also may increase the risk of, God forbid, cancer, which has happened in the past with other countries and caused some weird things. So you got to be careful what kind of stem cells, where were they taken from, etc. But anyway, this is just exosomes, so we can throw that out of the equation. The other thing you have to make sure is you're not just getting growth factors, because that's when the problem will potentially increase the risk of cancer or help cancers grow, because it is not contained in that submarine vesicle that is meant, that envelope, that letter specifically to your address. It is simply information, and that growth factor, if it is not inside the vesicle, it will go to whoever will grab it. And guess who will grab it? Cancer will grab it first, because they grow much faster. Just like when you eat sugar or you reduce sugar exposure, cancer seems to take it ahead. And so when you are doing, God forbid, anybody chemotherapy, they used to tell them, oh, you need to eat a lot of cakes and a lot of ice cream. It's wrong. Actually, the opposite is true, because the cancer will end up benefiting from more than your own body. So your body to be able to fight it, you want to actually restrict the amount of sugar and carbohydrates. So yes, when some of the companies come lipophilize where it's not the exosomes itself, but you have to add things to it. So it's like a powder. What they found that it breaks the cell wall, and the end product, it works. You feel good, but that's the growth factor. That's not the exosome. So you should not mistake the feel good with the safe, effective message that is specifically accepted by the cells. Now, the other thing that you said is you're doing the in vitro. And the question was, will it block or avoid the hair loss from the estrogen and progesterone that you're taking? And the answer is no, it is not meant to change your biological products. What it will do is it will mitigate it. And there was a study actually done where they took mice and they injected them with dihydrotestosterone. As we know, this is the hormone that comes from testosterone and leads to the miniaturization and the hair loss, the androgenetic alopecia in female and male. And what they did is, for some, they used a blocker, something that would block not the estrogen progesterone, but in this case, the testosterone, right? The DHT to block it. And they applied it like what we do Rogaine, right? That's how it works. And for the others, what they did is they put the exosome, just rubbed it on the skin. And they found that the exosomes, just rubbing it on the skin, not even microneedling it, worked more effectively than the organ, although it did not block the THT, which was injected into the mice. Mm-hmm. So it will mitigate the effect of the hair loss without interfering with the biological effect of this for your in vitro fertilization. Mm-hmm. You talked if you have folliculitis or you have pimples on the scalp. So the answer is you can avoid those areas. But again, if you have folliculitis on the scalp and it's not bacterial, but it's sterile, which most of the time that's what it is, this will not hurt it. If anything, it will help it, because folliculitis is an inflammation. Mm-hmm. And if you bring down the inflammation, that should reduce it. So you're not concerned when you're doing the microneedling and theoretically popping those vessels and spreading it, that you can theoretically spread it. As long as it's sterile, not viral or bacterial.
Bacterial.
Well, you can test it, number one. Number two, I can tell you. Mm-hmm. I'm an expert, no God, but I'm an expert, and I can tell this is not bacterial or viral or fungal. This is inflammatory type of folliculitis, which can sometimes happen when you have a little bit of dandruff or subdermal, stuff like that. Mm-hmm. I think that's it, right?
Yeah, that was me. Yeah.
Hopefully this was educational to you, and thank you very much for the questions, for allowing us to report it live. Thank you.